Let's talk about Garden classification of femur neck fracture. Garden classification is used to classify intracapsular fractures of the neck of femur based on the degree of displacement seen on X-ray, AP view of hip. It is divided into 4 types. Type 1. In Type 1 there's an incomplete fracture or valgus impacted fracture. The medial compressive trabeculae of head and acetabulum remain aligned. Blood supply usually preserved. And has best prognosis. Type 2. In Type 2 there's a complete fracture line without displacement. Trabecular alignment is maintained. Retinacular vessels usually intact. Still good prognosis but risk of displacement exists. Type 3. In Type 3 there's a complete fracture with partial displacement. In this type the trabeculae of head misaligned with that of acetabulum. Blood supply partially disrupted. And there's an increased risk of avascular necrosis. Type 4. In Type 4 there's a complete fracture with full displacement. Femoral head is completely displaced but often rotates back into a normal anatomical position within the acetabulum. Consequently, the medial trabeculae of the head appear to be aligned with the pelvic trabeculae again. Blood supply severely disrupted. And there's a highest risk of avascular necrosis and nonunion. Important points for exam. Garden classification applies only to intracapsular femoral neck fractures. Higher Garden type means a higher risk of avascular necrosis. Types 1 and 2 are undisplaced fractures. Types 3 and 4 are displaced fractures. Hope you've understood the concept. God bless you all. See you in next video.